Good afternoon, fellow Jamaicans, members of the media, my colleagues. My name is Julian Robinson, and I'm the General Secretary of the People's National Party. This afternoon, we are here to examine some of the issues around the management of COVID in Jamaica and to express concerns that we have about how the government has handled this particular issue. Over the last day, we had 98 positive test cases, and in the last 3 days, we have had over 160 positive cases. We believe the government can and should be doing things differently. And we, as a government in waiting, will demonstrate and show you some of the things that we would do to manage this crisis better. On the panel this afternoon, I have to my immediate left the Member of Parliament for Northwest St. Anne, Dr. Dayton Campbell. Beside him is our candidate for Southeast St. Mary, Dr. Shane Alexis, and joining us via Zoom is the spokesman on health, Dr. Maurice Guy. I'm going to start with Dr. Dayton Campbell to give his preliminary remarks.
All right, thank you very much, Jensek. Jamaica has been seeing a steady increase in COVID-19 positive cases and COVID-19 related hospitalizations in recent times. And this is expected to continue, especially in light of the fact that we're in the middle of a general election campaign. This has come about because of certain poor management decisions that has been taken by the government. The first thing is that they painted a picture that it's either you open the country or you would die from economic collapse. Jamaica at the same time did not pay attention to high-risk areas and to ban entrance from these areas. They prioritized tourists over the locals, whilst the Ministry of Tourism was boasting about the numbers of persons that were coming into the country. The Ministry of Health was not doing what was necessary to ensure that we would be able to test these persons and get back the test within time so that the appropriate management decisions could be taken. They mismanaged the pre-testing protocol, which has led to a part of this ongoing increases that you have been seeing. We have a low capacity for testing of entrance at our borders. You will realize that testing at the airport was very poor because persons took a very inordinate, a long time to get back their results. Some persons even left the country without having a test result. We have a large backlog of cases, or had, making contact tracing population larger and harder to trace these persons and effectively manage the individuals who are positive. We had poor management of the quarantine of our returning Jamaicans. With the geofencing, we know of individuals who pretty much just turn on their phones and leave it at home and they go out on the road. So there needs to be proper quarantine of these individuals with proper checks and balances to ensure that these persons are indeed in quarantine. The government had no real plan for frequent testing of hotel workers. We are now in the middle of a second spike with an increase in local transmission with supply chain issues concerning the PPEs. The minister says that we have all the necessary PPEs, but when you speak to the persons who are on the ground in the facilities, they're saying they don't have it, which means that there's a supply chain issue affecting that. And there needs to be a PPE manager maybe in the hospitals to ensure that sufficient PPEs are in the facilities and that persons are protected. This spike is also taking place with a general election campaign ongoing, and we have ballooning numbers of cases that are under investigations, which tells us that we are probably in the phase of community spread. With all this, the fact of the matter is that these things could have been prevented if different decisions were taken with the management of these issues. And so the government cannot escape taking the blame for allowing these cases to increase to this level and across so many different parishes. You had in the report yesterday about 6 or 7 parishes that are affected, that reported positive cases. And we think that there's a lot that can be done, and my colleagues will outline clearly what a future PNP government come September 3 will do to ensure that we can have a better control of the COVID-19 cases.
Thank you very much, Dayton. I'm now going to invite Dr. Maurice Guy to share his perspective on how the People's National Party would manage the COVID crisis in a better and more effective way. Dr. Guy.
Thank you very much, General. Good afternoon. Our concern about this management of the COVID crisis is that from day one, we have been giving suggestions to the government, which they have blatantly ignored, or if they have taken them on board, they have come way down the line. For example, on the 2nd of June in the Parliament, when we indicated to the Prime Minister that to reopen the borders, we should have pre-testing, they scoffed at that. They said no. So we saw 6 weeks later, when the numbers were rising, that the government introduced pre-testing from 4 states within the United States, and subsequently for those areas, all the areas of the United States, but 3 other countries. Secondly, we made recommendation about our visitors coming to the island and that they should be tested. That was not taken on board. We have seen since the reopening of the borders that the number of cases coming now, about 50 to 60% are imported, after we did so well from our first case test in March of this year. Now, we are also seeing where our national surveillance at our sentinel sites, that's right across the country, we have about 30 plus sentinel sites where samples are taken, that particular issue, that particular testing and sampling has broken down. Now, as a government in waiting, one of the things that we are committed to do is to beef up the resources. We were misled by the government when we were told that they had adequate testing with a capacity up to 3,000 tests per day. Yesterday was the first time that we ever exceeded 1,500 tests per day. The country was misled by the government in public relations to say we had that capacity, but yet we've never tested. My colleague Dayton mentioned about the backlog of over 10,000 cases. We were not told that numbers were of that magnitude until very late. When it was late, what that has done, it has put pressure on our scarce and our pressured healthcare workers to do the contact tracing. Now, what are some of the solutions that we would have? First of all, I'd invite us to look at our manifesto, but to say that one of the first things we will do in coming to office is to boost the capacity of our testing. We have over 3,000 testing per day. We will ensure that 3,000 tests are done so we don't have a backlog. People will get their results in 8 to 9 hours, so they will have an idea. We'll also look at the possibility, not the possibility, but opening the market to the private sector who have that capacity with PCR machines, and we will also morph the veterinary services, the university, the Ministry of Health, who all have PCR machines to do testing so we can do all the samples that are coming to this country. And further, we will require that those persons who are coming into the country will do a PCR test within 72 hours of arrival here in Jamaica, as well as to screen those who we consider may have the condition on their arrival at the airports. We need to boost our testing capacity. It is futile for us to ask our healthcare workers to grope in the dark to try and find out where these samples, where these infections are coming from, if we do not give them the tool. The first tool that we require to give them is the results of the tests that we do. These are some of the few, and we'll open the questions later on. Thank you.
Thank you very much, Maurice. I'm now going to turn over to Dr. Shane Alexis, former president of the Jamaica Medical Doctors Association and our candidate in Southeast St. Mary. Shane?
Good afternoon, everyone. It is now clear that we have not had a transparent or clear report from the government on what is the true status of COVID-19 in Jamaica. It was inevitable that we would have this spike because our largest market, where the diaspora is, in the United States, has been blowing up in recent weeks. Therefore, everyone in the medical profession knew that we would have more cases here in Jamaica. And what did the government do to prepare? Since January of this year, we were aware of a pandemic moving across the globe. We were told that we would have prepared places such as the National Stadium and other field hospitals to support the work of the hospitals. Remember, there are still people with diabetes, hypertension, cancer, dialysis that need help, surgery, our children, pregnant women, and the health services have to be able to withstand all of these challenges at the same time. Medicine is a science. You cannot hide the truth. The country deserves to know each day at a specific time how many cases of COVID-19 are with us so that we can make clear decisions such as reopening of schools or having them postpone the reopening of schools as needed. We can make better decisions for our business community so that the small businesses right across the island can survive. The PR show by the Prime Minister and Dr. Tufton is not sufficient to save lives. We now have over 1,200 cases and more to come. 15 people have died, leaving their families behind. What are we going to tell those families? That simply we didn't know or we were not prepared? As a government in waiting, we are prepared to take decisions on the first day to ensure that our capacity is increased, not just financially, but to ensure that our staff is motivated and refreshed. We cannot afford to have doctors at home or any other level of staff simply at home unemployed waiting for an opportunity to serve their country. We must ensure that all hands are on deck, that the private sector, the public sector, our trade unions, our grassroots community associations such as the 4-H Club, the Agricultural Society, the youth clubs are all engaged to get the message across. The government said that the mission was accomplished too early. They took their foot off of the gas in terms of proceeding to ensure that we could withstand any challenge to our healthcare service. Complacency is leading us down the wrong road. We need transparency and clarity on the true position, and we must also ensure that we are listening to those most qualified to guide the process. Those are the technical experts in the Ministry of Health. The Prime Minister and the Minister of Health are not trained in this area. They are not qualified to begin to lead the country to deal with a pandemic. We must now ensure, as a party, that we remain united, that we win the next general election to rescue all our Jamaican brothers and sisters from this COVID-19 pandemic. I think that we can discuss more points, Julian, but I think it is clear to me as a physician, as a former president of the Medical Association and other groups, that we must get all hands on deck, all the professionals at the table, so we make better quality decisions, because this thing is going to get worse before it gets better. And there are many frightened and nervous persons in our communities, especially the elderly, who believe that they are now prisoners in their own homes. And the Prime Minister and the Cabinet have made them stay in that prison for the last few months. Now, with more cases to come, how much more can we take as a country? Clear and decisive leadership and transparency to the population, in my view, is what's needed now.
Thank you very much, Shane. I'm going to invite members of the media to indicate your questions via Zoom. Just identify yourself and the media house that you represent. Any questions coming in? Members of the media, are you hearing us and you're able to respond if you need be?
In the meantime,
go ahead.
In the meantime, I think, Julian, it's very interesting to see what's happening across our own Caribbean region, how other countries are responding to the challenges they face. Whether it is curtailing some economic activity, and that's been a challenge, I think, for governments across the region. But it doesn't have to be one or the other. We can do both at the same time. It just requires very good management to assess the risks and implement whatever is necessary. I think that once we stick to the clear science, but we must communicate that at all levels, especially at the grassroots level. I think sometimes we, as leaders, may speak a little bit too high. We speak and make it sound really good and easy, but the average man in a market needs to understand that COVID can kill him the man in the bank needs to understand that COVID can kill him. So we're all in it together. And if he does his part and we do our part, then we're more likely to have a better outcome where we all survive. But I think at this time, the engagement of the population at the most basic level, and I think that the PNP, obviously where both parties are engaged at the grassroots level, it's a great opportunity for us as politicians to play our part and ensure that we are continuing to carry the message that we started, which is face mask wearing, social distancing, and of course keeping hands clean. If we stick to those, I think we'll get through it together, but we must have a clear, consistent message right across.
All right, thank you. I think we now have a question from somebody from the media. Could you go ahead, please?
Hi, good afternoon. Are you hearing me?
Yes, loud and clear. Go ahead, please.
Nadine Wilson-Harris from the Gleaner Company. In light of what is happening now with the COVID numbers, do you think that a wrong decision was taken in terms of calling the election for September 3?
Well, I mean, the decision to call an election is ultimately the Prime Minister's call. The Prime Minister had until March next year when the full term of the government would expire. The government and the Prime Minister would have access to data that other persons wouldn't have. And clearly, at the time the election was called, we were experiencing a spike in the COVID cases. Everybody knows the political culture in Jamaica, that, you know, we have nomination day where you have large gatherings, meetings where there are going to be interactions. So inevitably, the campaign is going to contribute to an increase in COVID cases. Now, obviously, as a party, once an election is called, we have to contest it. We don't have an option. But I think the government and the Prime Minister did have an option, and they had information. And from my perspective, they chose what I would consider their own interests over the health and welfare of the majority of the Jamaican people. But we are committed to contesting, we are committed to winning, and we intend to win on September 3rd. I don't know if my colleagues want to add anything.
Just that we are committed to also observing the protocols during the campaign. The fact of the matter, though, is that the Prime Minister and the Minister of Health and the Ministry and the Cabinet in general, they would have access to all of the information, as was said before. They would know the number of cases. We had a significant backlog. They would have known what time it would take to clear up that backlog. They would have known these things. They also are the ones who are charged to put the necessary measures in place. We cannot govern the country from opposition. And so the governance of the country is based on the government of the day. If they decided to call an election, they should look at the pre-testing protocol, how they're going to amend that to ensure that persons coming into the country are tested. They should also ensure that when persons show up at our borders that they are tested. And how do we put state quarantine and state isolation in place? Within the different parishes, we look at putting cough and fever clinics so that individuals who are presenting with those symptoms can go there and take the burden off the sector. And so a government has to manage and govern a country. That is the duty of the government. The duty of the opposition is to highlight these flaws that they have, to make proposals as to how we can better manage the situation. And if an election is called, we have an obligation to contest the election, observe the protocols that are in place to win that election so we can implement our policies. But we are not going to run scared when an election is called. We are going to contest it, and we're going to contest it to win it.
But if I may, sir, I noticed that the opposition leader did not raise an objection when the election date was called, even to say on the record that, you know, there are concerns with COVID, etc.
Well, you know, you're in a catch-22. You know, if we raise those concerns, which we have consistently throughout the period, people would interpret that to mean that we are afraid of an election. So yes, when the announcement was made, we welcomed it, and we have conducted a campaign. We have encouraged our supporters to abide by the protocols. It has been challenging because you're dealing with a culture that has evolved over 50 odd years. And as I said, once an election is called, we have to contest. But the decision to call it, with all the data that the government would have had at its fingertips, was ultimately the Prime Minister's. And I think the Prime Minister would have to accept the responsibility, knowing the culture that exists within the political environment, and knowing that it would be very difficult to contain the enthusiasm that surrounds election campaigns, which would contribute to a spike in the COVID numbers.
Sir, if I may though, is the opposition prepared to take any responsibility too, given the fact that on nomination day, persons from both parties were out, they were without the mask, and you had acknowledged that it was difficult to get persons to commit to social distancing and other protocols. Do you think you were complicit as well in terms of when we consider the
put it this way, I mean, I speak for myself, and I'm sure I speak for my colleagues, we gave out masks before we started our nomination day activities. We encouraged, we had people with sanitizers there, but there's so much you can do to control enthusiasm and no more. So we have certainly played our role in trying to ensure that our supporters abide by the protocols. Yes, clearly there were persons on both sides who breached the protocols. What I'm saying is the decision ultimately to go to an election is the Prime Minister's, and he had all the information available to him, and from my perspective, he had 6 more months to make a decision about when to go, and he has chosen it at the apex of this virus, the outbreak of this virus.
And the fact of the matter is that he didn't need nomination day to tell him how persons were going to respond. He did a tour prior to calling the election. And whilst he was doing those tours, he was going, especially when he went across the northern and western end of the island. On those tours, you had persons that were gathering in numbers and without any social distancing and those things, without masks. I saw a clip where he was asking persons to put on their masks. He knew before announcing it that just with politicians being on the ground, approaching a campaign period, that persons were going to come out in those numbers. And so he had that to guide him prior to calling it. And he, having all that information, as Jensek has said, decided to call the election. So your concerns about the election being held whilst there's a spike should be placed to the Prime Minister, who is the person that announced the date.
If I can just...
Oh, Morris, go ahead, Morris.
I'm sorry.
And also you'll recall, Dayton, that during this period also, the press highlighted these issues and concerns. And certainly the Prime Minister had his ear attuned to the press to know what was happening. He knew what was happening out there. He is the one who heads that subcommittee of the cabinet on the COVID response. So he would be totally aware of what was happening out on the ground. He gets the results from the public health team. So he knows the Prime Minister made the decision having all that information in front of him. So it is unfair or to suggest that the opposition is complicit in this. We, as the General Secretary said, belong to a political party, and we are obligated to contest this election on behalf of the people of Jamaica.
Shane?
Just on a point of science. The majority of cases that have been reported as positive are imported cases. The decision to open the borders and increase flights from North America, from hotspots such as Florida, was approved by the cabinet, and the cabinet is chaired by the Prime Minister. It is logical that as the United States would have more cases, more of those people coming on flights back home, we would have an increase in cases here in Jamaica. That has nothing to do with politics or a political party. It is simply an economic decision that was taken to allow persons to return home from an area that is considered internationally, if not the first, the second highest incidence of COVID-19 returning to the country. The Prime Minister used the same judgment when I believe it was in the Alarica situation, that the ministry, J. Cesar, was advised of the concerns to do with call centers. They sat on the recommendations for more than a month. J. Cesar is in the ministry overseen by the Prime Minister, the office of the Prime Minister. So the same Prime Minister that asked us to believe him that yes, they would clear up the call center situation, has returned again to make a decision admitting more and more persons from hotspots without testing them, and 2 months later saying, yes, we can go ahead. So, Nadine, to answer your question, I think the science shows that the majority of the cases in this second wave or spike are imported cases, not community spread cases. And the second point on that I'd like to say is that it is obvious to us as physicians that there is community spread. We do not have to wait on an international organization like the World Health Organization to give us a definition on community spread when it is clear that it is moving right through various communities. As you see, there are several parishes under quarantine now, and we must act and implement and activate the necessary measures to curtail this, and as the next government we will do so. But the issue of politics and calling an election, the science does not bear that out. We now have to ride this horse home, and as a People's National Party, and as the GenSec has indicated, and the party president, we intend to do that in a responsible and conscious manner to ensure that all voters, from whichever P, no P, the next P and our P, that they will be protected once they are participating in the democratic process.
Thank you. Are there more questions from the media?
Yes.
Okay, go ahead and identify yourself.
Good afternoon. I'm Jovan Johnson from the Jamaica Gleaner. Dr. Alexis, I want you to square the position you just articulated in respect of the Prime Minister or the Cabinet, for that matter, allowing Jamaicans to return home with the call by the opposition itself earlier on that Jamaicans overseas have a constitutional right to enter their country.
I'm glad you raised that point, Jovan. There is no inconsistency between what I've said and what has been said in the past. The call to ensure that persons are tested within a window before coming on a plane to Jamaica is an issue of safety. It's not a legal issue. It has nothing to do with human rights or rights guaranteed to all Jamaicans under the Constitution. So it's not an issue of barring entry. It is simply establishing the protocol, just like when we all go to the supermarket or go to church, we must spray, wash our hands, put on our mask, that sort of thing. We can institute protocols for Jamaicans or any other nationality coming to Jamaica. So that decision, belatedly, as Dr. Guy pointed out, is why we are here. And so that is why I am saying that the issue of judgment, the issue of transparency, the issue of responsibility rests with one person, because the Prime Minister is who signs off on that final decision. I think those questions are questions that should be asked of him. If he knew what he knows now, what would he have done? And I think he would find that he would say it was not a good decision at that time, and that what the opposition was asking him to do, based on scientific research, would have been a better option, and we would not be here now.
Jovan, any other questions from any member of the media? Okay, let me thank my colleagues for participating, fellow Jamaicans, the members of the media who posed questions to us. Just to let you know and to reassure you that the People's National Party will abide by the new measures that have been announced. We are going to be encouraging all our supporters and all Jamaicans, because ultimately health is the most important thing and life is very important to us. We are going to conduct our campaign up to September 3rd, and we will do it within the confines of the guidelines and the regulations that have been set out by the government and the Ministry of Health. We do believe that the government has made some critical mistakes which have put us in the position that we are in, and they could have foreseen that there would have been this peak in the number of cases that we are now experiencing. We know as a future administration, we would handle those matters differently, and we have outlined very specific measures that we would have taken to ensure that we would have avoided this. We encourage Jamaicans to continue to follow us. We released our manifesto yesterday. The full document will come out shortly. The debate starts next week, Tuesday. So tune into social media and otherwise to hear what we have to say as we move forward to victory on September 3rd. Thank you very much.